And then we're going to now have Evelyn Alvarez from Bronx Rebirth Collective Doula Network in the Bronx discussing their work. We've been hearing about the critical importance of doulas all throughout this morning's conversation.
Hi, sure. I just want to also share that I'm here with my colleague and co-founder, Nicole Baptiste. And so we'll be sharing some time and we'll make sure to um, make it every effort to shorten our session. I'm going to start here to share my screen. It's good to see you all this morning and hear all of these exciting things that are happening locally. Um, Let me just close this off here, share my screen. And here we go. All right. So, oops, sorry. Slideshow. Here we go. Can you all see my screen?
Yes.
Awesome. Thank you so much. So, Nicole and I are here from BX Rebirth and Progress Collective, and we are a doula-based collective in the Bronx. Nicole, do you want to take this one?
Yes. Hi, everyone. It's good to be here. Such rich info being shared. And I'm going to try and make this brief. What's a doula? We're trained professionals. We come and we provide what's key is continuous support. And I think that, for folks who are familiar with what doulas do, that is the really key component to some of the more positive outcomes that we see. Continuous labor support provided to people throughout their birthing experience. So it's one-on-one care, which makes the distinction between what you'll receive from the medical team in the hospital, right? We provide informational support. We're hands-on, as you can see from the picture here. It's physical support, it's emotional
I'm
support.
sorry, Nicole, can you speak a little louder? You're very low.
Okay, sure. Let me try and adjust my audio. Is this better?
Yes,
Okay,
definitely. Mm-hmm.
I'll keep trying to project as well. Emotional support to birthing people, also their partners. There's this misconception that doulas step in and we're taking over for the partner. That couldn't be further from the truth. We're trying to integrate all of the folks who can really build up and lift up this person during this really critical time in their lives. And then we also work with them throughout the postpartum period. Our role, our agenda, it's tied solely to the birthing person. That's who we're centering. We're hired by birthing people for the most part, and you will have some doulas who do work within hospital-based systems.
Yeah, thanks. So here we have just some general benefits of doula care, right? Where the health benefits include lower rates of preterm birth and low birth rate, decreased use of pain medication, reduced rates of medical intervention, and greater breastfeeding success. We also have emotional benefits of doula care here, which include decreased rates of postpartum depression, increased sense of empowerment, reduced anxiety and stress. And so obviously you'll see here that we have highlighted or bolded the greater breastfeeding success in line with what it is that we are navigating. But we also wanted to give you a little bit of information about us, tell you how it is that we started and what it is that we're working on. So we started in 2020 where we were donating as a result of what had happened in our communities during the pandemics, diaper, wipes, and formula. The three co-founders, Nicole, myself, and Carmen Mojica, who's also a midwife, are also all doulas, and it felt very reasonable that we also start to offer doula support in the community. And so Nicole primarily coordinates and runs our doula program, which she will speak to, and also speak to how we integrate breastfeeding support during our work with the patients that we support.
Yeah, thanks, Evelyn. One of the hallmarks of our doula program is that at every step of the way, we are promoting the involvement of the person who's seeking the support, right? And so that starts at the point in which, after which they submit a referral form. And so lots of programs, you'll see there's a matching process between doula and client, and it kind of happens arbitrarily, but we really want to avoid any sort of confusion. And we want the person who is needing the support and will ultimately receive it to be a part of who it is will provide it for them. So there's a whole interviewing process that goes on. And this happens across the board, whether you are someone who is paying out of pocket for doula services, or you are receiving the benefit of having this service waived through our fundraising efforts. So we work with people prenatally as well as through our on-call doula program that is right now based in Lincoln Hospital. And so earlier, Deputy President Janet Peguero, she mentioned that the Bronx Health Link is very active in what the maternal health landscape in the Bronx is right now. We actually partner with the Bronx Health Link, and this is through this partnership that we're able to provide the Lincoln Hospital on-call doula shift model. And so what that looks like is we're deploying doulas once a week, so work 12-hour shifts, and they are meeting people where they're at. And a lot of times they're supporting folks who are showing up to labor and delivery in labor by themselves, or who speak a language that at the time, maybe none of the other staff on the floor speak. And so we're finding that the support is absolutely critical. And for the most part, the outcomes are just really through the roof in terms of breastfeeding, as well as people achieving their birthing goals.
Thank you. And so what this looks like in action is, our work is physical support, as we talked about before, mental and emotional support. And physical support might include providing physical comforts during labor. Mental and emotional support includes reassuring, being a cheerleader, right? Building that community and that relationship with a client right off of the bat, especially because in some of our work, we have not met that person prior to them supporting them in labor. And then also informational support. And so here we get to support with not only creating a birth plan, but also, as some of you have mentioned before, a plan for breastfeeding in the event that the person has to go back to work, or is a single person, or has other issues. And then how does it look? It also, we support with advocacy, offering the support in amplifying a client's voice during labor, and specifically as it pertains to breastfeeding support, is really creating the relationship that allows us to create a container where the client will address concerns or fears about breastfeeding, provide, again, continued reassurance and guidance. So, as Nicole mentioned, offer support on how partners can assist and offer practical assistance. I know that's one thing that Nicole is great at. As a CLC herself, she's also able to support our colleagues and our teammates that are interested in offering breastfeeding support by having continuous support of someone who they can tap into. We also wanted to talk a little bit about some of the goals that we have as it pertains to breastfeeding, and Nicole will take that as well.
Oh, yeah. One thing I do want to lift up is that, yes, let's get as many people trained to become breastfeeding peer counselors, CLCs, IBCLCs. And we need the folks who are actually doing this in real life, in real time, to share their stories in the ways that we've heard about are happening in the baby cafes and chocolate milk cafe and these support groups. Evelyn mentioned I'm a CLC. Yes, before that, I'm a mother of 2 children who collectively has breastfed for close to 4 years. And that is the experience that I'm bringing to support clients. And yes, stories are very, very important. And so one of our goals is to create an ongoing support group comprised of our past and present clients to really uplift the benefits of breastfeeding, and also to champion people who are pregnant now and maybe considering, or not even considering, but bring it onto their radar where breastfeeding is concerned. And I think we've heard across the board here today that this is one of the most impactful ways to improve breastfeeding outcomes, right? We need people to support other folks and to actually plant the seed that, yes, you can do this. Mom didn't do it. Grandma might not have done it, or she shunned it, but this can be a goal of yours and you can achieve it. And so that's something that we really want to bring to fruition throughout our community.
Definitely. And in the spirit of wanting to be fair and reduce our session, we'll stop here. But thank you so much for listening and for including us in this awesome event.